Anglian Dental were instrumental in evaluating my problem. They found a solution to it and they came through on the results. The reason actually that I chose Anglian, I think the fact that the clients that they have spoke volumes for me. They work with clients who are within the NHS, but they also work with clients who are top-end clinicians and have top-end practices. And I built on that by speaking to other people who had used them. For me, one of the big things was bringing the West End into Ealing. That's where Anglian were able to help me. I had the opportunity to go to different practices. I had my own preconceived ideas of what the practice could look like. But the way we were able to put that on paper was a collaboration between the designer from Anglian Dental and my interior designer. And it was really having at least 2 or 3 meetings where we really got down to the nitty-gritty in terms of the floor plan, the materials that were going to be used, the chairs, and we were able to come up with what we have here, and it was a nice process. If I was to do another refurb, I would definitely look at surgery ergonomics in much more detail. I think what that has done for me in terms of ease of work in surgery 1 is phenomenal. I love working in that surgery because it's just designed in terms of how I work. And interestingly enough, all the other clinicians who subsequently joined the practice, they also like working in that surgery. The nurses like working in that surgery. So there's obviously something in that whole philosophy in terms of how you design a surgery to your workflow. For advice for future people doing refurbs, if you can get the opportunity to look at the way you work, it's really important that you encapsulate that into your design. I think the patients see that, and that's why I see that being a correlation in terms of the business getting busier and busier. I would describe Anglian as honest, hardworking, and reliable. So for me, that's what Anglian stands for. They walk the walk and they talk the talk.